Hey, Dr. Bob here of Proactive Wellness and Injury Center, and I wanted to share some information with you that is out there available for public knowledge. However, most of the public isn't aware of this information. And I wanted to share with you this startling fact that at least 2003 is the number of elite athletes and professional athletes have since 2021. It's been recorded 2003 individuals have suffered cardiac events since 2021. And of the 2003 of those individuals, 1,400 of them have died. 1,400 of 2003 elite athletes since 2021 have died of heart attacks or other heart ailments. And this is what's so amazing is prior to 2021, we did have athletes that were dying, but the average was anywhere between 30 and 70 a year. Now, I'm not demeaning that number, but I'm telling you that there was an astronomical increase from 2021 to present, when we were averaging maybe 30 to 70 individuals that were dying a year, and now it went up in 2021 to 2023. 1,400 of them died. And this is what's really, really amazing. Where these people that died of these individuals that died of these heart events, none of them had pre-existing heart problems. So in other words, of these 1,400 individuals that died, that were these prime in their life, elite, well-conditioned athletes, none of them had heart problems before 2021. But yet after 2021, 1,400 of these 2003 individuals died. What did they have in common? That's the question, right? You always want to go upstream and find out what the causative factor or what was the common, thread that bound these individuals together. And the one thing, according to the statistics and the research that they had in common was this. They all did what they were told during that time. They all did what they were told to do during that period of time in order to protect themselves from a particular disease. That's what they did. That's the only thing. That's the one thing that was common in each and every one of these individuals that died, each and every one of these 1,400 in the prime of their life, well-conditioned elite athletes who had no problems prior to 2021. And that's just the number of elite athletes that we're aware of that died because of heart problems, because they did what they were told to do in order to protect themselves from a particular disease during that time. It's not over. It's your body, it's your health. You make the decisions when it comes to your health. Be aware of that. But in order to make a quality decision, you need to sit down before you decide to do something. Sit down with your doctor, with your primary physician, whoever it is that you have entrusted your health to, and have that conversation. Is this something that I should do? Is this something that truly is going to benefit me? What does the research say? What are the benefits that I can gain, and or what are the adverse reactions that could happen to me as a result of this decision? You owe it to yourself, you owe it to your future, you owe it to your health to ask these questions and to demand answers from a physician, from a practitioner who is insisting that you take this route of action, this course of action, right? Absolutely. That's what these individuals did, unfortunately. They didn't ask questions for whatever reason, and I don't know. That would be unfair of me to go ahead and assume. I don't know, other than I do know this. They all did what they were told in order to prevent this disease from coming upon them. They took that action, and now they're no longer with us. So, learn from the past. Ask questions, be satisfied with the answers before you take any action in regards to your health. And that doesn't only apply to this instance. anytime, every time you do anything, you take any action that you feel is going to benefit your health, make sure you know exactly what you're doing and that you have credible reason and information for doing so. Hey, thanks a lot for allowing me to share this information with you. And until the next video, and as always, God bless.